My name is Dr. Ian Storch. I'm a board certified gastroenterologist and osteopathic physician, and you are listening to D.O or Do Not. If you're interested in joining our team or have suggestions or comments, please contact us at doordonotpodcast.com. Share our link with your friends and like us on Apple Podcasts, Facebook, Twitter, and Instagram. We hope you enjoy this episode.
My name is Aaron Plummer. I'm a pre-med student at the University of Central Florida, and you're listening to the D.O or Do Not podcast. This week, we are joined by Dr. Michael Foti, a dedicated physician who serves as a professor at Touro College of Osteopathic Medicine, bringing his expertise and passion for medical education to the next generation of healthcare professionals. With the recommendation from the esteemed individual John Gimpel, Michael brings a wealth of experience as a practitioner and educator. His journey, much like his passion for mental health advocacy, embodies resilience and compassion. As Michael reflects on his own challenges and triumphs, he echoes a sentiment from his journey. You should never let where you come from dictate where you go. He will start by sharing insights into his harrowing experiences as an intern during the height of the COVID-19 pandemic, grappling with chaos and loss in the hospital. Then, he opens up about his personal battle with anxiety and depression, shedding light on the stigma surrounding mental health in the medical profession. Finally, Michael shares how he turned his own struggles into a mission to advocate for physician wellness and support medical students in their journey. I'm confident you'll find Dr. Michael Foti's story both engaging and insightful. May his journey inspire you on your own pursuits.
Michael, thank you so much for being with us tonight.
Thank you for having me.
Michael, first of all, you have been recommended by multiple people, including John Gimpel, who thought you'd be amazing to be with us, as well as Touro, the school that you're teaching at, which you're going to talk to us a little bit about. And you actually reached out to us as well, which always makes us flattered that you're interested in talking to our listeners and being on the podcast.
The pleasure is all mine to be here.
There are a couple of topics that I know that you're passionate about that are clearly super important. Mental health for physicians, which I know is a passion of yours, and again, so important. Can you talk to us a little bit about how you got involved in this, how you became aware in this, your own personal journey with mental health issues, and how you've developed it as part of what you do on a daily basis now?
Honestly, it all started when I was an intern in internal medicine residency. And I was an intern in 2020, which, as we can all know, was the height of the COVID-19 pandemic. And when that, as you can all imagine, for someone in their first year of training, was really tremendously a lot on us, all of us who were involved in working during that time, 12 to 16 hours a day, constant chaos in terms of patients desatting and oxygen levels dropping on an hourly basis, having to be a part of the decision on whether patients were going to be intubated and placed on a mechanical ventilator, which was happening really every hour. And these were patients in their 30s and 40s, patients that should not be suffering from disease and being stuck in a hospital bed this age. And this was in the entire hospital. That most of our patients were quite young, and this was patients who were close to my age. And so it was definitely a lot. And there was the patients who I was holding their hands as they passed away because their loved ones couldn't be at their bedside. I was calling their loved ones to tell them that they loved them because they were too sick themselves to do so, right? And this was happening on a daily basis for months. And at the same time, I unfortunately lost my mother suddenly, passed away due to complications of what was found to be undiagnosed stage 4 lung cancer. So a lot was going on at the same time. I truly didn't get to grieve her loss because only days later after her service, I was back to working in the hospital because obviously we were in the thick of COVID. fast forward to becoming an attending physician is when my anxiety and depression really manifested. I was awakening every morning with an intense fluttering in my chest. I was awakening every night with intense panic as if someone was ripping open my chest, someone was squeezing my arm. And this was happening every day and then every night for months. And initially I blamed it on the job. But even though I eventually did switch jobs, this continued. And this developed into a severe depression. I was ashamed. I was hiding in my basement away from my son and from my wife. I was ashamed to look them in the eye because my whole life, the expectation was to become a doctor. And it had come to a point as if I couldn't live up to that expectation. And that's where this intense shame really came. And it all boiled over one night where I had such intense panic that I thought maybe this isn't panic at all and maybe this is my heart. I went to the emergency room. Of course, all testing was negative, and I was later diagnosed with anxiety and depression. And one day I said to myself, not for me, but for my wife and my son, I need to get the help that I need. And so I saw my primary care doctor. I was placed on an antidepressant. I was referred to a psychologist who I was seeing weekly, and I put in the work on me. And eventually, through tireless hours of work, I did overcome my battle with anxiety and depression.
That's some story, Michael.
Yeah.
I'm sure a lot of people went through it and they just won't speak about it. So tell us a little bit about how you took that experience and brought it to helping physicians.
I think it first took a lot of realizations on my part. So I realized first that I had this intense shame for multiple reasons. One being that, I had paired my identity with being a doctor. And when that came into question, so too did my identity, my very being. And that's why I became so shattered, right? And I think that was a big part of it. And I think another part of it was also the very obvious stigma of mental health and medicine, where as healthcare workers, especially doctors, we're expected to be perfect and we're not expected to deal with mental health disorders. And if we were to develop something like that, in our eyes, it's seen as a weakness. And this is a stigma that's been perpetuated for many decades, and it's something that we need to combat, because whether we're a doctor, a medical student, a resident, we are just as human as anyone else. So developing anxiety, depression, or any mental health disorder due to suffering, loss, grieving like I had, that's part of the human experience. And to think otherwise is unfair to anyone in the healthcare field. So once I made these realizations, I decided, well, if I was suffering in silence, so too could medical students and residents and attending physicians and anyone in the healthcare field. So I decided to speak up, to be strong enough to share my story. It all started at Touro in Middletown, Touro College of Osteopathic Medicine, where I first shared my story. And after doing so, it led to the other campuses wanting to hear my story. That turned into regional presentations, national presentations, and most recently, presenting at the Health Workforce Wellbeing Day at the National Academy of Medicine in Washington, D.C., speaking alongside our U.S. Surgeon General, Dr. Murphy, to be able to speak up on physician wellness. So it's really been a domino effect, but it's been truly humbling and honor.
It's amazing, Michael. I'll say that I think there's a lot of talk about physician wellness and well-being, but my personal experience is that I know two doctors. One is a good friend's partner, and the other one is actually a doctor in my own specialty who are local who committed suicide. And I
So,
feel
so
like
sorry.
it's so sad. And I feel like a lot of times it just gets swept under the rug and people don't address these mental health issues. And I think what you're doing is so important.
Yeah, I mean, that's the thing. It's we're the other part of this is we're taught as not taught maybe necessarily, but I think again this culture has also continued where we're in our minds we need to just push through. If we're having anxiety, well, you just push through it. You're feeling depressed, well, you just push through it. But we have to stop. We have to stop trying to push through it Because if you don't process all of these emotions and all the things that we see as doctors, it's a lot that we see as doctors and a lot that we're witness to. And we're human. We have emotions. And as much as we try to say we leave our emotions at the door so we can empathize with our patients, well, of course, but we're human. It affects us. And if we don't process it and really reflect on it, it's detrimental to our own health. And that's what happened to me because I pushed through the pandemic and didn't really process anything of what I was seeing and going through, all the death and suffering I was witness to. Well, that led to a very severe anxiety and depression on my part. And I don't want that really to happen to anyone else.
Mike, at Touro, Middletown, you have like a coffee clutch with a sign or something like this for students that are going through stress. Can you talk to us and tell us a little bit about that?
Yes. So I developed something that I call Cafe Foti, where I have a coffee machine in my office. And I figured if I could set aside a time where my students could come in and, whether it be review topics, get career advice, or really just have a safe space to hang out and talk about what's going on as a medical student and just reflect on the day, why not, right? And I could provide them free coffee, provide them free snacks, and the students really just fell in love with Cafe Foti, so much so that a group of first-year students bought me a sign that's on my wall in my office. It lights up and it says Cafe Foti. So it's now become ingrained in the culture of Touro, Middletown, and it's an honor on my part that they find my office to be that type of safe haven.
Now, Michael, if I drive through Middletown, will you let me come for a cup of coffee? You have to be a student, or how does that work?
Not at all. As much coffee as you want.
Awesome.
Many
Awesome.
other faculty and staff stop in too, for sure.
Awesome. Michael, there's one other topic before we go into your journey and what you're doing now. One of the things that I wanted you to talk to us a little bit about is maintaining osteopathic medicine across specialties. I know that's something that's dear to you. Can you talk to us a little bit about that?
I think that many of my students, because I also teach in our osteopathic manipulative medicine department in our OMM1 lab. I'm the OMM1 lab leader. And one thing that they ask me is because they know I'm actually an internal medicine physician by trade, and they say, "Well, Dr. Foti, you also love to teach OMM. Did you get to practice OMM?" And fortunately, I do have to tell them, no, I didn't really get to because as a primary care physician, you only have so much time with your patients, unfortunately, as most primary care doctors can attest to. You only have maybe 15, 20 minutes with your patients, and that's not enough time to also provide OMM. But it saddens me because it's the reason why I teach it. We're taught such amazing skills of this hands-on medicine of osteopathic manipulative medicine in the background of the philosophy of OMM, which of course we like to carry through, and I think many DOs carry through. But to also lose that hands-on tool if we go into another specialty, I think is unfortunate, right? So I hope and my goal is to try to encourage as many of my students as possible to continue osteopathy in their practice by trying to kind of build their own practice, whether it's in a medical group or not, or a private practice, to have that be, whether it's in their contract or what have you, that it's built in that they are allowed to practice osteopathic manipulative medicine. And again, this is more of a systemic issue that we can address, that they need to be addressed more on a national level. But I encourage all my students to, before you sign on the dotted line, if you want to continue osteopathy, get that built in where you could have those visits, because it's very unfortunate if they can't continue that forward.
I think that's a great lesson to teach students. And just small question for you. So I do a lot of colonoscopies and endoscopies. I don't do manipulation in my practice, but oftentimes when I get home from work, my son has a really bad back. He's 15 years old from lifting his book bag, which I'm convinced of that. But he often figured out at some point that I can still do HVLA, and he asks me to work on his back. Now, does that count for me or not really?
Well, I think you're providing a great service to your son, but I would love for there to be more, right, to bring it into the practice. But I think that I'm quite impressed, to say
Yeah.
the least.
Just being a little silly. Just being a little silly. All right,
Yeah.
Michael. So obviously, we know you're in Middletown now. We're going to talk a little bit about your journey, but everybody loves you there, obviously, which is why we're having you on the podcast. But can you tell us your exact title there and kind of what your day or what your week looks like?
So I hold a few hats. I'm a clinical assistant professor of internal medicine. So I teach in our preclinical courses for first and second year osteopathic medical students, both in our physical diagnosis course for first year students, as well as our early clinical experience course for our second year students. So our physical diagnosis course is teaching basics of physical examination. Our early clinical experience course is teaching our second year students to basically the skills of clinical reasoning through case-based learning. I am also the standardized patient program coordinator. So I'm the coordinator for the program for standardized patients by recruiting, hiring, and training our standardized patients for our OSCE encounters. And I'm also, as I mentioned earlier, the lab leader for our osteopathic integrative medicine lab for our first year students.
That sounds like a lot.
Yeah, a lot of my students like to tell me, Dr. Foti, don't get burnt out. You're doing too much.
Plus, you are a barista at Cafe Foti, I assume.
That's my side gig.
Exactly. All right. So, Michael, we're going to shift gears. Can you tell us where you grew up and when you decided you wanted to go to medical school, when you decided you wanted to be a doctor?
Grew up in the Bronx, New York, originally. It's funny, I've always wanted to be a doctor. I'm sure you've probably heard this before. But the story that I'm told by my grandmother is when I was younger, my brother developed chickenpox. We brought him to the doctor. And when we were leaving, I turned to my grandmother and I was like, that's it? And she said, yeah. And I said, oh, I want to do that. I want to be a doctor. And since then, it's never changed.
That's great. Tell us where you went to college and when you learned about osteopathic medicine and what your application process was like.
So I went to what is now Iona University. When I attended, it was Iona College in New Rochelle, New York, which is in Westchester County. I actually knew about osteopathic medicine because one of my cousins, who is currently a plastic surgeon, went to my alma mater as well, where I wound up going, which is the New York Institute of Technology College of Osteopathic Medicine in Long Island, New York. So I already knew about, in a way, in a sense, osteopathic medicine, but I didn't really fully know it. I just knew that that's where he went to school. So my pre-health advisor, though, explained a little bit more, and then I did my own research. And once I had learned about very much the mind, body, and spirit philosophy of osteopathy, the hands-on tool, I fell in love and knew I wanted to go to NYIT because my cousin had gone there, and thankfully the stars aligned, and I actually wound up going to NYIT and graduating there in 2019.
Okay, so can you tell us about how you chose internal medicine as a specialty and how you chose your residency program and what that was like?
I fell in love with internal medicine actually third year of medical school. It was my very first rotation. And I had an attending physician who was wonderful. We did bedside rounds. I loved the discussion. Felt almost like an investigator or a detective trying to figure it out, tying all the clues together. I had the lab values. Sometimes you had imaging, and you kind of had to tie it all together to figure out what was going on. And my attending was so kind to bring us to the bedside and correlate the pathology we had discussed with actually exam findings. And that's when I fell in love with internal medicine. In terms of my residency program, it wasn't even on my initial list, Greenwich Hospital. But when I went there to interview is when I fell in love with it. It's a small community hospital, but everyone seemed to know each other. They were so kind to us when we arrived and we were touring the hospital, and it felt really like a second home. But then at the same time, it is one of the Yale hospitals, so you do get education from Yale faculty, which I was drawn to. And the main thing for me was when they talked about the wellness committee there, that the residents ran a wellness committee, and that really spoke to me. Because at the end of the day, I wanted to be happy. If I was going to spend 3 years somewhere putting in tireless hours of work, I wanted to be happy. And the fact that they put wellness at the forefront really spoke to me. And it really did wind up being that. I loved my time at Greenwich. I would go back in a heartbeat. And I think it's a phenomenal program.
So the only hiccup in the whole thing is that you were there during COVID. So obviously you loved Greenwich, but that whole part that we spoke about, you would really attribute to the fact you got whacked with COVID at the beginning of your residency. Is that correct? Is that right?
That's exactly right. Now, I will say that the program supported us as much as they could during that time. Obviously, it was a pandemic unprecedented for 100 years. But I will say that I was so happy to have been there during such a time, because to have that type of support and that place that did feel like home in such a chaotic time was probably the best thing that could have happened in the worst of times.
I'm just going to make one small comment. Your story is so interesting. And I actually worked on a COVID floor during the pandemic, and I was bonding afterward with one of the senior endoscopy nurses who used to be an ICU nurse and worked on a COVID floor during the pandemic as well. And she was commenting on her observation that a lot of the younger nurses, really took things very, very hard and really just felt that unfortunately the situation was what it was, and they hadn't had experience with death and loss and anything on the scale that we saw during COVID. And she really just felt that it was a sad situation. I think that kind of sums up what you said earlier in the podcast.
Yes, I think because of the scale of it all, right? So everyone in the healthcare field does deal with death and loss every day, all day, was, I think, really why it affected us so much. And the fact that we were seeing such young people suffer all day, every day. So I think it was the scale and the magnitude of the suffering, and it felt like it was never ending for a time. And I think that's why it affected so many people so much in the way it did.
So getting back, so happy ending. Thank God we get out of the pandemic, and now you're finishing up your residency. Were there a lot of DOs in your residency?
Actually, yes, half my class were DOs, which was actually, it was encouraging for sure.
And did you notice any difference in the residency? It's a Yale affiliate. There are MDs and DOs working together. Did you see any difference between the MDs and the DOs in the program?
Not so much. I think in terms of, I even had attending MDs and DOs as well. And fortunately, like I said, they weren't really able to carry on the osteopathy and the OMM in terms of working in the hospital. And as DO residents, we did want to continue in terms of using these skills, but unfortunately we weren't able to, because it wasn't really built into the program, and most of the faculty of the residency specifically were MDs and they were not DOs. So they weren't really licensed to supervise our OMM. So that was disheartening. But I will say one thing that always strikes me with DOs, and that did strike me there, always that extra mile in terms of addressing things outside of the problem that the patients there themselves. That always carries through. And I did notice that at my program, and always even after when I graduated too. I think we as DOs really go the extra mile to make sure that we're encompassing everything that can affect that patient's care, mind, body, and spirit. And I think that definitely carried through.
All right, Michael. So now you're finishing up your residency and you're starting to think about a job. Can you tell us a little bit about that process and what you went through?
I knew from being at my program that I wanted to go into academic medicine. And my program was actually nice enough that they allowed me to build an elective where I was able to teach medical students that we had rotating there on rotation to see if I liked it. And I did. I loved teaching them. I actually built a curriculum while I was a resident there. So I designed the curriculum myself. That was basically physical diagnosis skills. And we also went into our simulation lab, and I built the curriculum from scratch. And then I was able to implement it with medical students there. And they loved it. They wrote me cards after that they were so appreciative for the extra teaching that they didn't even know they were going to have. And it was phenomenal. So I knew I wanted to do academic medicine. So my first job outside of residency, fortunately enough, because I didn't know if I was going to be able to as a new attending, was as a resident preceptor in an internal medicine clinic for a residency program, which was great. But as I mentioned, this was when my anxiety and depression really manifested. So unfortunately, I thought it was due to maybe I was too young and too early in my career to be a residency preceptor. So that's when I transitioned over to working general primary care. But the anxiety and depression did continue. But after I was able to get the help that I needed, I knew I wanted to go back to academics. So I actually did for 6 months teach at my alma mater, MYIT, COM. which was great. And then I was offered an interview here at Touro, Middletown, be not only an assistant professor, but also run the standardized patient program, which was very appealing. And also the fact that I live much closer to Middletown, New York, than I do Long Island at the present moment. So been since July. I've been here 8-9 months now, and it's been amazing. I love my time here.
That's great. And you're obviously gaining recognition, both, as I mentioned, both with the Osteopathic Society at large and with your students. I applaud you for that.
Thank you. Yeah, I know. Honestly, it started as I knew I suffered in silence, and I didn't want anyone, especially our medical students, to suffer in silence. The statistics show that 30% of our medical students across the nation are suffering from anxiety and depression, and about 10% at any given time have suicidal ideation. And that's just struck. And it was for students who are sacrificing their lives, their time, for future patients. They should not have to suffer in silence. So I just really wanted to reach as many students as I have been able to. And the fact that this has turned into now national platforms, speak with our Surgeon General, for example, this past Monday, it's been phenomenal. And I hope that this journey doesn't end, and I hope to continue to be given platforms such as this today and moving forward, so I can continue to reach as many people as I can.
So, Mike, I know I'm putting you on the spot now, and you're a young osteopathic leader, but outside of continuing the work that you're doing, are you going to be dean of a med school? Like, where do you see yourself in 10 years?
One can only hope. Teddy Roosevelt said, keep your eyes on the stars, but your feet on the ground. So, yeah, I would love for in the future to eventually become a dean, because I think I can enact change at the curricular and policy level, both at a medical institution and also more nationally. So I would love to have that position and that voice. But I'm just going to continue to put in the work day in and day out and hope for the best.
It's awesome, Michael. I know you're going to do well, no question. So we have our last grand finale question, which is, can you give us one piece of advice that you were given from someone else that you have found deep and meaningful and you would like to share with our listeners?
The best advice I got during the darkest time of my life that I already described is be kind to yourself. And I tell this to my students every day. We tend to, as those in the medical profession, we tend to be perfectionists because we think we're expected to be perfectionists. And we tend to not be kind to ourselves. We tend to beat ourselves up like, oh, I should have done better. I could have done better. We are in one of the most emotionally distressing, stressful jobs and for really professions that anyone can be at. It's a true vocation. And we are sacrificing a lot of ourselves, but we cannot grow as human beings if we're not kind to ourselves and give ourselves credit for what we're doing day in and day out. So I tell everyone out there, be kind to yourself. And also remember, this profession, it is what you do. It is not who you are. Remember that we are more than this profession. We are so much more uniqueness to everyone outside of this profession. So remember that, nourish that part of yourself, that things that you do outside of work, outside of school, and remember to really nourish that part of your soul, because that uniqueness is so important to what you will bring to your future patients or your patients right now. I think those are two pieces of advice that I always tell my students every day.
That's awesome, Michael. Again, thank you so much for spending time with us tonight. I very much appreciate it.
Thank you. Thank you so much. I really appreciate this.
This concludes our episode of Do or Do Not. Send all inquiries, comments, suggestions, and even let us know if there's someone you want us to interview to doordonotpodcast@gmail.com. Don't forget to like us on Facebook at Do or Do Not Podcast for updates. If you enjoyed our podcast, please share it with your classmates and administration. We have plenty of more interviews lined up, and we're excited to share them with you. This is Tian Yu Shea. Thank you guys so much for listening to Do or Do Not.